Hi, I'm Star Jones. Over the last 25 years, I've had the privilege of interviewing everyone who is anyone, the famous and the infamous. Really interesting people, from presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some really cool everyday people. They've all sat down for the Star treatment. Welcome to the Star Treatment. Today, I'm proud to introduce you to Dr. Jeffrey Bora, a cardiologist and professor of medicine who helps the next generation of physicians hone their skills and broaden their knowledge. Dr. Bora, welcome.
Thank you.
I want to know a little bit how you grew up and what made you interested in cardiology.
I became interested in cardiology because I was always interested in sports. And it occurred to me when I looked around at people who I knew and relatives, if you had heart disease, you might live a long time, but you had to sit on the sidelines. You weren't allowed to participate. That was something that I thought would be very, not at all congenial for me.
I guess you were saying to yourself you wanted people to be able to have a full life.
That's right.
And participate in life. So take me through your professional background, sir.
I was accepted at Harvard when I was 16 years old. From there I went to medical school, to Cornell University Medical College. It's now called Weill Cornell Medicine, but it's the same place. And once I finished medical school, my training began at the Massachusetts General Hospital in Boston. After a couple of years there, I moved to the National Institutes of Health, to what's now called the National Heart, Lung, and Blood Institute. I was there for several years, completing the requirements for a board certification in cardiology as well as internal medicine. While I was there, I applied for a Fulbright fellowship, and I became a senior Fulbright Hays Scholar.
I'm overwhelmed with the amount of work that you've put into not just your career and the profession, but just the specialty of cardiology. Was there a particular area that you were attracted to?
I became very interested while I was at the NIH in heart valve disease, and so that became my particular area of interest.
As you know, I'm a heart disease survivor myself, having had my aortic valve repaired just under 10 years ago. So I think about everything that I had to learn about valve disease. And you'll forgive me if I say to you, I always thought heart disease was an old white guy's disease. I never thought that it was something I had to worry about, but I'm not unlike a lot of people.
That's right. The old white guy's disease is coronary disease. What you had was a congenital heart abnormality, which can affect anyone.
So what is the most rewarding aspect of your profession?
Most people think of the work of a doctor as being to evaluate patients and provide care, and it is. But for someone in academic medicine, that is someone who works for a medical school, there are actually three aspects of the work. There's the patient care, there's teaching future doctors, and research, which is the creation of new knowledge.
I would love for you to brag for a bit, because this is my favorite topic. What are some of the professional accomplishments that you've had over the years?
I've published more than 500 full-length articles in medical journals and book chapters, and 8 books.
Would be remiss if I didn't ask you, what about some personal accomplishments, Mr. New Yorker?
Well, there's no question that the personal accomplishment that means the most to me is having married a wonderful woman 42 years ago and having 2 terrific kids.
What would you like your legacy to be?
I would like my legacy to be the capacity to ask questions and the understanding of the method to answer them. And as a personal issue, I would like my legacy to be that people would think of me as somebody who was good to his word.
I'm so honored to do this with Marquee Who's Who. What does being a Marquee Who's Who list mean to you?
to be listed is an honor. But the fact is that the honor only comes if you've done something to earn it. And it's nice to be recognized.
I am very privileged and happy to have had a chance to highlight your professional career. You've done a great service to a lot of us, and personal point of view, I'm very appreciative. I'm Star Jones for Marquee Who's Who, profiling the leaders of American society, men and women who are contributing to our nation's development and achievement. Stay tuned to this channel for more interesting features on truly exceptional people.